Dr. Fortna here to give you an update from the Hanna Community Medical Clinic on what's been happening for us. So I just want to reassure everyone right now that there are 0 cases in our special areas zone and in our Hanna Hospital. That will change in coming weeks, but right now we do not have any. We want to let you know that we are prepared. We have organized our resources, we have organized our hospital that when it does come to Hanna, we are ready for it to come and to manage it in the safest way possible for our residents and for our health workers. I want to thank everyone in the community who has been making shows of support to essential government workers, essential public health workers, and certainly certain health workers as well. You guys have been wonderful. When we come home from shift and we see Christmas lights and we see stained glass windows and we see snowmen, it helps us smile and remember why we go to work in the middle of the night, so thank you. We have received numerous gestures of support, both words and gestures in the community, and we really appreciate that coming from you. I want to remind all people that communal food products is definitely a no-no right now. So if you have a box of donuts, you distribute them and then you put them in the freezer or the garbage. Nobody should be going into your donut box multiple times. We should all be having our own servings. I know in this situation we want to come together and share food, especially with the Easter season coming up, but a reminder that communal food in an office setting is not a good idea right now. Okay, we each get our own chocolate box. The same procedures apply right now for people who are unwell. So for sure, first and foremost, if you need emergency care, our ambulance service is working, 911 is working, and our hospital is open 24/7. You still access those services. If you are unwell but don't need those services, self-isolate at home and or call the medical clinic and get some advice from our nursing staff or from your family doctor. All 4 physicians in Hanna are well, and we are providing care for patients in hospital, at home, in the clinic on an as-needed basis. One advice tip here for people who have lab or x-ray forms. Please only go up to the hospital to get these forms done if they have been given to you in the last week by a physician and told that you should get them done. If there is a question about a specialist form, please contact the medical clinic and get advice as to whether or not it needs to be done at this time. We want to limit the risk to you in coming to the hospital, and we want to conserve our lab resources for when we truly need them, hopefully after the virus has finished its spread. Another reminder on that front, if you have a specialist appointment outside of Hanna coming up, please, if you have not heard from your specialist, phone them a day or 2 before your appointment, before you drive into the city, just in case their office is closed or they are doing virtual visits via telephone or the computer. We don't want you driving to a city unnecessarily. A reminder again that if you need to be seen by your family doctor, please call the medical clinic. We are booking on a week-by-week basis, and we will fit you in to receive a phone call or an in-person visit, either in your home or in our clinic, depending on what your certain circumstances are. I think that's all for now. Thank you for your continued support, and we're all in this together.